Yusimry, CF, pen 40 mg per 0.8 ml subcutaneous injector is a medication used to reduce pain and swelling caused by certain types of arthritis, as well as certain skin disorders such as psoriasis. It works by blocking a protein in the body's immune system that causes joint swelling and damage in arthritis, and red scaly patches in psoriasis. This medication belongs to a class of drugs known as TNF blockers. It is also used to treat certain bowel conditions such as Crohn's disease and ulcerative colitis, as well as a certain eye disease called uveitis. Taking this medication can help reduce further joint damage and preserve joint function. The recommended daily dosage and the optimal timing for taking this medication will depend on your specific condition and should be discussed with your healthcare provider. Before starting to use Yusimry, CF, pen 40 mg per 0.8 ml subcutaneous injector, it's important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for clarification. When using this medication at home, it's essential to learn all preparation and usage instructions from your healthcare professional and the product package. Before using the medication, visually check for any particles or discoloration. If you notice either of these, do not use the liquid. If you are removing this medication from the refrigerator, leave it at room temperature for 15 to 30 minutes before injecting. Do not warm up this medication in any other way, such as by heating in the microwave or placing in hot water. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. New injections should be given at least 1 inch, 2.5 cm, from an old site. Do not inject into any areas of the skin that are sore, bruised, red, or hard. Use this medication exactly as prescribed. Inject this medication under the skin on the thigh or abdomen as directed by your doctor, usually every other week or once a week in some cases. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you are using this medication to treat psoriasis, hidradenitis suppurativa, Crohn's disease, ulcerative colitis, or uveitis, your doctor may prescribe a different schedule/higher dose at the start of your treatment. Carefully follow your doctor's directions for using this medication. It is important to use this medication regularly to get the most benefit from it. To help you remember, mark the day on the calendar when you need to receive this medication. Do not increase your dose or use this drug more often or for longer than prescribed. Tell your doctor if your condition lasts or gets worse. If you experience redness, itching, pain, or swelling at the injection site, it's important to inform your doctor or pharmacist. This medication has been prescribed to you because the benefit outweighs the risk of side effects for most people. However, it's crucial to watch for signs of infection, such as a persistent sore throat or cough, fever, or trouble breathing. Additionally, be aware of any serious side effects, such as irregular heartbeat, mental/mood changes, or difficulty with muscle movements. It's important to seek medical help if you experience any very serious side effects, including seizures or chest pain. And if you notice any symptoms of a serious allergic reaction, such as rash, swelling, or trouble breathing, seek medical help immediately. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. This medication can lower your body's ability to fight an infection, which can increase the risk of serious infections. Inform your doctor about your medical history, especially if you have had infections in the past. Also, let your doctor know if you have lived or traveled in areas where certain fungal infections are common or if you have been near someone with tuberculosis. Your doctor will test you for tuberculosis before and during treatment. If you are diagnosed with TB, your doctor will first prescribe treatment for this to prevent a serious TB infection while using Yusimry, CF, pen. There is a small risk of developing cancer due to this medication, especially in children, teens, and young adults. Discuss the risks and benefits of treatment with your doctor and tell them right away if you experience symptoms such as a fever that doesn't go away, unusual lumps/growths, swollen glands, unexplained weight loss, or night sweats. Before starting Yusimry, CF, pen 40 mg per 0.8 ml subcutaneous injector inflammatory bowel agents, it's important to let your doctor or pharmacist know if you have any allergies, particularly to adalimumab products or natural rubber/latex. This medication may also not be suitable for those with a history of infections, blood/bone marrow problems, seizures, certain brain/nerve disorders, cancer, heart disease, or lupus. It's important to be cautious when taking this medication, as it can increase your risk of infections or worsen current infections. You should avoid contact with anyone who has a contagious illness and speak to your doctor if you have been exposed to an infection. Before getting any immunizations or vaccinations, inform your healthcare professional that you are using adalimumab. It's also important to avoid contact with people who have recently received live vaccines. To reduce the risk of injury, be careful with sharp objects and avoid activities that may result in cuts or bruises. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications you are using. Older adults may be more susceptible to infections and cancer while using this medication. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. Additionally, if you are breastfeeding, consult your doctor before continuing to breastfeed while using this medication. It's important to be aware of potential drug interactions that could affect how Yusimry, CF, pen 40 mg per 0.8 ml subcutaneous injector works or increase the risk of serious side effects. Make sure to keep a list of all the medications and products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Yusimry, CF, pen 40 mg per 0.8 ml subcutaneous injector include other TNF blockers like etanercept and infliximab, as well as other drugs that weaken the immune system such as abatacept and anakinra. Be sure to discuss any concerns or potential interactions with your healthcare provider. If someone takes too much Yusimry, CF, pen 40 mg per 0.8 ml subcutaneous injector and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the United States, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share Yusimry, CF, pen 40 mg per 0.8 ml subcutaneous injector with others. Your doctor may also recommend lab or medical tests, such as a complete blood count or liver function tests, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, talk to your doctor or pharmacist for a new dosing schedule. Do not take extra doses to make up for the missed one. When storing Yusimry, CF, pen 40 mg per 0.8 ml subcutaneous injector inflammatory bowel agents, it's important to keep it in the refrigerator, but do not freeze it. Some brands may also be stored at room temperature, so be sure to check with your pharmacist or read the product package for specific storage instructions. Once the medication has been stored at room temperature, it should not be put back in the refrigerator. It's best to keep the medication in the original container to protect it from light and to discard any unused portion. Remember to keep all medications away from children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.